You hear a general practitioner talking to a patient called Mihiraa. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. How have you been since our last visit?
Hello, morning, Dr. Williams. Honestly, not too well. My arthritis has been flaring up again, and I feel much more fatigued recently.
Can you tell me more about this? Are the joint pains the same as before, Mihiraa, or have they changed in any way?
My arthralgia, particularly in my hands and knees, hasn't improved significantly. It makes even simple tasks like holding a cup or getting out of bed a struggle.
Have there been any other changes in your symptoms, Mihiraa?
And the fatigue? I can barely manage half my usual energy levels, and sometimes I get dizzy spells.
That's helpful information, Mihiraa. Have you noticed any specific triggers for your joint pain or dizziness?
Well, I do feel stiffer after gardening or walking for long periods. The dizziness usually happens after I eat sugary foods.
I see. Have you been following the medication regimen we discussed last time?
I try my best, Dr. William, but sometimes I forget to take the medication on time, especially when I'm busy. Additionally, my glycemic control hasn't been as optimal as desired.
It's important to be consistent with your medication, Mihiraa. It helps manage your symptoms and prevent complications.
I understand the significance, Dr. William. I will make a concerted effort to adhere more rigorously to my medication regimen.
All right. Have you made any lifestyle changes since our last visit, Mihiraa?
Yes, I've been making efforts to adopt a healthier lifestyle. I've recently joined a walking group with some acquaintances, and I'm trying to integrate a greater variety of fruits and vegetables into my dietary intake.
Excellent. These changes are crucial for managing your diabetes and overall health. However, based on your symptoms, Mihiraa, I believe we need to adjust your medication slightly.
Okay, what do you recommend?
Mihiraa, I'm considering switching your current pain medication to leflunomide. It's a disease-modifying anti-rheumatic drug that can help slow the progression of your rheumatoid arthritis. Additionally, I'd like you to try metformin XR for your blood sugar control. It's a once-daily medication that could improve your blood sugar stability.
Are there any side effects I should be aware of?
Like all medications, these can have some side effects. However, most are mild and manageable. Mihiraa, I'll provide you with detailed information about them.
Okay, thank you, Dr. William.
To further assess your overall health and monitor your response to the new medications, Mihiraa, I'd like to schedule some additional tests. I'd like to recommend some blood tests, including an erythrocyte sedimentation rate and C-reactive protein to assess inflammation levels.
Sounds good. What do I need to do to prepare for the tests?
Please remember to observe 8 hours of abstaining from food before the blood test as usual to ensure the accuracy of the results. We can schedule the tests for next week. In the meantime, Mihiraa, remember to take your medications as prescribed and continue with your healthy lifestyle changes.
I will, Dr. William. Thank you for your help.
You're welcome, Mihiraa. Remember, managing multiple health conditions like these requires collaboration. Don't hesitate to contact me if you experience any regressing symptoms or have any questions between appointments.
Extract 2. Questions 13 to 24. You hear an ENT specialist talking to a patient called Mihiraa. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good afternoon, Mihiraa. I'm Tim Crane, your ENT specialist today. What brings you in today?
Hi, Mr. Crane. It's actually my parents who insisted I come in. I've been having this terrible sinus congestion for weeks now, and it's driving them crazy.
I understand. Can you tell me more about what you feel? Mihiraa, how long has it been bothering you?
It started about a month ago, I think. My nose is constantly blocked, and I have this dull ache in my forehead and cheeks. Sometimes, my face even feels swollen.
I see. Are there any other symptoms you've been experiencing, Mihiraa?
Yes, actually, I have a lot of post-nasal drip, which makes my throat feel scratchy and sore. I also get terrible headaches, especially when I wake up in the morning.
Have you tried any remedies to alleviate these symptoms, Mihiraa?
Oh yes, I've been using over-the-counter decongestants and nasal sprays, but they only provide temporary relief. I even tried taking some steam baths, but nothing seemed to work for long.
I see. Now, Mihiraa, is there anything in your medical history that I should be aware of?
Yes, I am allergic to milk and I have type 2 diabetes.
Thank you, Mihiraa, for letting me know. Are you currently taking any medications for your diabetes?
Yes, I am on glipizide twice a day.
Okay, understood. Now, based on your symptoms, it sounds like you might be experiencing sinusitis. Mihiraa, this is an inflammation of the sinuses, which are air-filled cavities in your skull.
Sinusitis? Oh no, that sounds serious.
It doesn't have to be, Mihiraa. Acute sinusitis typically resolves spontaneously within a few weeks. However, given the persistent nature of your symptoms, I would advise initiating a course of antibiotics, specifically bactericides, to address the infection and promote a speedy recovery.
That sounds good. What kind of medication are we talking about?
Mihiraa, I'll prescribe amoxicillin, which is generally well tolerated and effective against common sinus infections. But remember, antibiotics won't address any underlying allergies or sensitivities that might be contributing to your problem. In addition to the medication, Mihiraa, I also recommend some lifestyle changes that can help manage your symptoms. Try using a humidifier at night to add moisture to the air, which can loosen mucus and make it easier to clear your sinuses. You can also try nasal saline irrigation, which involves flushing your nasal passages with a saltwater solution. This can help remove irritants and allergens, Mihiraa.
I'm happy to try those things. Is there anything else I can do to prevent this from happening again?
Well, it's important to manage your allergies effectively. Mihiraa, talk to your doctor about allergy medications or immunotherapy if needed.
That makes sense.
Now, if your symptoms don't improve with antibiotics and lifestyle changes within a week or two, Mihiraa, we might need to consider further investigations like a CT scan to rule out any structural abnormalities in your sinuses.
Okay, I understand. Thank you so much for explaining everything, Dr. Crane. I feel much more informed now.
You're welcome, Mihiraa. Additionally, avoiding your triggers, like dust mites or pet dander, can also help reduce the risk of future sinus infections. And remember, follow the instructions for the medication carefully and come back to see me if your symptoms persist or exacerbate.
That is the end of Part A. Now, check your answers.